Today, we'll talk about one of the most pressing issues in value-based care: readmissions. While a return to the hospital might seem like just another data point, it often signals a breakdown in the continuum of care and a real human cost. Let's dive in. A readmission refers to the instance where a patient who was previously discharged from a hospital or healthcare facility is admitted again within 30 days of the initial discharge. But why do readmissions matter? First, patients who are readmitted have a higher rate of morbidity and mortality. Therefore, the rate of readmissions is a direct evaluation of the quality of healthcare delivered to the patient. The second reason is that it's expensive. A single hospitalization can significantly increase costs for a value-based care organization. On top of that, readmissions actually cost more than the initial admission. So, on average, a hospital admission is going to cost an organization $14,500, and a readmission is going to cost them $16,000. They then have to pay both of those. So, a patient who is readmitted now costs $30,000 instead of their initial $14,000. Organizations will want to avoid this. Although you may not control all the factors contributing to a readmission, awareness of the most common causes will enable you to proactively solve for them in many situations. Certain conditions have higher readmission rates. Actually, according to recent data, the most common cause is circulatory system diseases, accounting for 16.8% of cases. Next are infectious and parasitic diseases at 12.4%. And finally, digestive system diseases contribute to 11.6% of readmissions. Understanding this is crucial for reducing readmissions and enhancing patient outcomes. Additionally, there are three major factors contributing to readmissions: post-discharge visits, medication reconciliation, and barriers to care. So, the first thing we're going to talk about is the post-discharge visit. This is simply a follow-up visit with their doctor after they leave the hospital. Now, the reason this is important is that the longer you wait to see your clinician after hospitalization, the higher your rate of readmission is. Even waiting just a week can double your risk of being readmitted, so the sooner you're seen, the better. Ideally, we aim to have patients seen within 72 hours after discharge. That's the industry standard. The next thing we're going to talk about is medication reconciliation. This occurs during the post-discharge visit, but it is important enough to warrant discussion as a separate issue. A medication reconciliation is simply looking at and discussing with the patient the medications they're currently taking after leaving the hospital. Medication changes in the hospital can be lost in translation if not reconciled with previous medications. In addition, patients often don't take the medicines they're supposed to, as they appear to be doing. They may also be getting medications from a specialist that you're unaware of. This is a good time to review every medication they're taking. Ideally, they bring in their pill bottles, and you can look at them physically and say, "Okay, are you taking this or not?" The last of the three major factors contributing to readmissions is the presence of barriers to being able to stay healthy. Essentially, what are the reasons that lead to readmissions that are problems for the patients? This includes health literacy, transportation limitations, access to specialists, and medication affordability. These individual barriers to staying healthy not only contribute to hospital readmissions, but also reflect broader systemic issues. Ones that help explain why, as a nation, the U.S. struggles with overall health outcomes compared to other high-income countries. Americans have lower life expectancies and higher rates of avoidable deaths than residents of other high-income countries. Life expectancy in the U.S. was 77 years in 2020, which is 3 years lower than in similar countries. The U.S. also has the highest rates of multiple chronic conditions, with 30.4% of adults having at least 2 chronic conditions. In addition, no significant strides have been made to reduce readmissions. From 2016 through 2020, the 30-day all-cause readmission rate has remained consistent at 13.9%. While the financial impact of readmissions to the healthcare system is important, the individual impact on each of your patients is even larger. Adults over 50 years of age are shown to have significantly decreased muscle strength, increased incidence of falls, and overall worse quality of life following a hospital admission. these patients have difficulties with an increasing number of ADLs with each subsequent admission. Given the fact that a patient's ADL capabilities are directly correlated to their risk for readmission, we start to see a negative compounding effect on the patient's quality of life. The impact of avoidable hospital readmissions is uniquely felt at the healthcare organization level within the value-based care space. Many value-based care organizations shoulder the financial responsibility of their patients' medical expenses, including hospitalization costs. Therefore, when practicing in value-based care, it is imperative to invest into strategies to help prevent readmissions. This focus on preventing admission makes a noticeable impact. A cross-sectional study looking at 5 chronic ambulatory care-sensitive conditions showed the relative risk of avoidable hospital stays was significantly lower among Medicare Advantage patients compared to traditional Medicare. As a primary care clinician, your awareness and ability to address the causes of hospital readmissions can lead to significant change. It will not only impact the quality of life of your patients, but will contribute to the success of your organization and the healthcare system at large. As a clinician practicing value-based care, you are in a unique position to have a positive impact on readmissions. So, what can we take away from all this? Readmissions aren't just a number on a chart. They're a reflection of missed opportunities to support a patient, to prevent decline, and to avoid unnecessary costs. But good news. Many readmissions are preventable. Whether it's ensuring a post-discharge visit, reconciling medications, or removing access barriers, your actions as a clinician or care team member can significantly impact the trajectory of your patient's care. Thanks for watching. To learn more about value-based care, visit our VBC Hub